All right. Hi, everybody. My name is Marketa. I am the Executive Director of ANA California, and I am here with our lobbyist, Roxane Gould, and we are to give you a quick rundown of the new 2021 legislative session. So, Roxane, tell us what's new, what's exciting, what's happening.
Well, first of all, they decided to call it 2021-2022 session.
Really?
You call it 2020, 2021. But the legislature functions with 2-year sessions. They were scheduled to go back into session on January 4th, 2021 for the first year of its 2-year session. Due to COVID related concerns, they delayed that start date to January 11th. And they've hit the ground running. It didn't impact any of the deadlines or any of that. They've begun to introduce legislation, but we've got 10 new assembly members. We've got 7 new senators, brand new to the legislature. We also have a vacancy where Assemblymember Weber, who was appointed to be Secretary of State, is now people are starting to vie to replace her. So as they're introducing legislation, we're monitoring everything. They're actually even starting to amend some of the bills that were introduced as of day one. And they've introduced, as of the end of January, 625 bills. And what makes that curious is that it actually is more legislation than previous sessions. In 2019, by the end of January, there were 544. By 2017, and also the end of January, there were only 469. And so the reason we find this curious is that the assembly leadership has told assembly members not only should they focus only on budget issues, wildfire issues, COVID issues, and homelessness, yes. But they'll go outside of those lines. They'll color outside of those lines, but they've been told only introduce 12 bills. So they're either going to be very limited in what they introduce later, and they're just anxious, or they're going to ignore what leadership has told them. And I'm told the Senate is not given a cap per se, but has discouraged them from introducing as many bills as they would in previous years.
So you mentioned, Roxane sent me a little synopsis of what we're going to be talking about. And you're mentioning here that 25 bills of the so far introduced bills are spot bills, and then 250 bills are intent bills. Can you tell us the difference?
Absolutely. And I mean, the legislature is comprised of deadlines, and deadlines can always be weighed with the number of votes. But there was the bill introduction timing has already started. The deadline to introduce bills is actually February 19th. So they're scrambling to get them what is called across the desk. So it has a bill number, but an intent bill basically means, I'm Senator X, and the intent of my bill is to accomplish X, Y, and Z, and they will submit language of substance, put meat on the bone at a later date prior to the deadline date, when what are called spot bills or intent bills must be amended to be bills of substance or they die.
That's interesting. I know we talked about it, a few years back, but can you explain again, why is it called they must come across the desk from the old days? Why it is across the desk?
And I think they literally do still put it across the desk. But so if you have a bill idea, it has to go to an entity in state government called Legislative Council. And what they do is they confer with the member and staff and determine, what is your objective? What code section are you going to be impacting? And then they put it in legalese. So it will fit in with existing code if the bill is to be passed and signed. So you go through that step, then they get the bill language, but there's no bill number. It's just a draft bill. They have to walk it to the Senator Assembly chambers. They hand it to the desk staff, who literally push it across the desk, give it a bill number, stamp it, date and time, and all of a sudden, AB 139 exists. And then from that day forward, a bill has 30 days prior to its ability to be heard in committee, so that there's enough time to fully vet and people to review and analyze the legislation that was introduced. And so we're going to start seeing hearings relatively soon. And the one caveat I would say is, if a bill has an urgency clause in it, that means all deadlines are waived. A bill can be heard immediately. And it also means that as soon as the governor signs it, it takes effect and is law. So if the governor were to get a bill by April 1st, that law, instead of having to wait until January 2022 to take effect, would take effect immediately, in which case there were a number of COVID-related bills that had urgency clauses that took effect immediately last year.
Sure. I really like, how it has to come across the desk, or, how, because I remember we talked about it in the past, how it's literally across the desk. So anyway, so you're now a little bit more in the know on, the insider language. So we have that. I think that one of the first letters, or one of the first coalition you as our members saw, or maybe the members of the legislative committee saw so far, and we're going to be sharing it with everybody else, is the coalition efforts to support governor's budget proposal authorizing medical coverage of continuous glucose monitoring, CGM. My mom actually has one, and so I know how important that is, and how it really improved her diabetes management, and she swears by it, and it's just absolutely fantastic. So I can kind of see why it's important. We shared the coalition letter with you a couple of days ago, and we're going to be also sharing it later. I reached out to several of our coalition partners, and ACNL is the next organization that is also signing up on this. I reached to other organizations, and they're also discussing it within their structure. So it's wonderful to see more nursing organizations taking these important stands. So that's one thing. Roxane, I wanted to ask you, you mentioned that we would see committee hearings soon. One of the biggest thing is the BRN sunset. And so I was on a several call with the BRN executive officer, Lori Melby, and she mentioned that on BRN website, you can actually go right now and see the summary and the report they submitted, the mandated report they submitted to California legislature. So they submitted it, they're waiting for the legislature to come back at them and ask if they have more questions on specific issues. And then they're waiting to hear when there's gonna be committee hearing scheduled. So we don't know, apparently we all know that it's gonna be, of course, virtual. But Roxane, do you agree that we just don't know when we'll see, but it should be maybe somewhere like spring? It has to be spring, right? Because that's the first committee.
Right. And budget committee hearings are already taking place, the budget subcommittee hearings. And so you have you have a budget subcommittee dealing with health, you have a budget subcommittee dealing with transportation. And this is where it really, oftentimes bills that are called trailer bills are negotiated and introduced to basically enact the budget. So if the governor says he wants to accomplish X, Y, and Z, whatever the particular subject matter area is, that budget subcommittee delves into the details and looks to find funding and the mechanisms to accomplish the stated goal of the overall budget. And so conversations are taking place now. I believe the budget subcommittee on health has released their agenda maybe as early as this afternoon, and we can get that out to ANA members. But it will start to happen. The governor actually will start to have bills implemented and could take place as early as March on budget issues. He will come back with what's called a May revise, which is he's already introduced his initial budget. Last year, you might recall, I think we thought we had a surplus in January, and he came back with his May revise, and we had a $54 billion deficit. So you alter and amend and mold the budget in May to fit the realities that exist. And hopefully we'll be past a good deal of the pandemic concerns by May. And oddly, actually, the budget, they underestimated the amount of revenue that was going to come in. And so we actually do have a surplus in the budget despite 2020. So when May comes around, that's when they're going to be deciding how much money do we have, how much of this budget can I actually implement, and everyone is going to be fighting for a piece of that pie.
Absolutely. And the reason we are talking about this is obviously, because of the continuous glucose monitoring, and also the BRN sunset, because BRN is using state funds, and therefore it must be part of the budget. And so that's why, everything is connected to everything else. We have so far, Roxane is compiling all the list of interesting bills so far being introduced. So we don't have really our tab yet, because it's still happening. but she sent me a couple of new bills, and one is AB 32, and that states that telehealth, which we already use now, but telehealth will be telehealth visit will be same. They will have the same extent as in-person diagnosis, consultation, or treatment for medical managed care plans. So that is really important, because as of right now, managed care, medical managed care plans are exempted from this. So this bill is trying to also assure that, increased access to care, because while I can call in my doctor and have a discussion, patients and medical, they cannot. So that's why it's so important that this is increased access to care. And then the next one is AB 285, and that would create the position of state school nurse consultant, be part of the Department of Education agency. So far, these are the first we're kind of hearing about. Roxane, anything else a little bit, just before we started recording today, anything else came across your desk?
Well, there's a bill, SB, no, I lied, AB 410, and by Assemblymember Fong, creating a nursing compact. And so I haven't had a chance to fully analyze it yet, but it's a topic that has been pretty contentious, and it's been introduced in previous sessions. So we'll be analyzing it, sending it out to members so it exists. But otherwise, typically hundreds and hundreds of bills will be introduced on the last day or two of session. So anticipate a pretty comprehensive list of bills starting February 20th. And that's when we'll have an idea of bill hearings. That's we'll have an idea of where people really are trying to, pass public policy impacting nursing. And that's when we'll hit the ground running.
Absolutely. And so to close this very first welcome to 2021, 2022 legislative session, I think I'm frozen in time in that horrible 2020. We wanna share or remind you again about these two dates, and one is Monday, April 12th, 2021, where we're gonna have virtual lobby day. Obviously, it's gonna be much shorter event, just different. Roxane and I will be there giving our presentation. Then we can do some Q&A. We will follow up with, hopefully we will have some good, at least two juicy bills that we can analyze and talk about. And so it's going to be obviously much shorter event. Even last year, National ANA, when they did virtual lobby day, it was really asking nurses to submit letters of support to specific 3 topics. So it's going to be a little bit different. And then the next day, Tuesday, April 13th, we will have our General Assembly, and where we're going to be working on bylaws, and which will be the part of the business meeting. We are trying, please bear with us, we are trying a brand new flexible format. So we will share all of that with you. Just please know that it's coming, and I know that you receive save the date, and so Jared is working feverishly to finish the last changes I asked him to do for the registration page. So that should be coming very early next week. So April 12th and April 13th. Registration link is coming. Please share it with all your networks. And we thank you so much for your time. We thank you so much for your membership in this fantastic organization. And I thank Roxane for her time and for her expertise and for her analysis. And we look forward to connecting with you towards the end of February, where we're gonna have, some exciting bills to discuss, right?
Right, absolutely. And also, I'd like to add, on April 12th, we're going to be having some we're setting up high profile presentations that I think will be of great interest to membership. So please mark your calendar and look forward to this virtual, exciting event.
Yay, Zoom. All right. Thank you so much, everybody. Please take good care of yourselves, take good care of your loved ones, and stay safe. Thank you. Bye.